Once upon a time, some liberal arts students and myself decided to take a course in engineering for non-engineering majors. We thought we'd broaden ourselves in that fashion. So we went to the course, and the instructor was a very kindly person, a gentle person, an enthusiastic person. But he made all kinds of assumptions about what it is that we already knew about mathematics, unwarranted assumptions. And he would fill the blackboard with equations and all kinds of numbers and lines and squiggles. And we'd sit there saying, I wonder what he means by that. What's he talking about? And I don't remember ever finding out. Has that sort of thing ever happened to you? Well, this kind of instructional error is not uncommon, where instructors don't know what needs to be taught before something else can be profitably learned. The simple fact is that some things can't be learned until other skills, other knowledge is in place. For example, you can't practice long division until you know how to add and subtract. You can't practice troubleshooting until you know how to recognize normal and abnormal characteristics. Now, this may seem very obvious to you, but common educational practice not only allows students to move ahead without having basic skills in place, but frequently it requires them to do that. They get passed from one grade to the next, and little by little being less able to deal with the world around them and having their self-confidence eroded at the same time. Now, if you've got a hierarchy, you can avoid many of those problems. Hierarchy drafting is the fourth in a series of 4 steps in deriving objectives from the job itself, from the real world. But we're asking you to practice this one first because it will save you from developing a little troublesome habit that you might develop if you started with the task analysis. So let's start with drafting hierarchies. You can draw your hierarchy in any manner you fashion, any manner you want, any style that pleases you. Just make sure that when it's finished, it has all of the pieces. Now, let me demonstrate the procedure of drafting a skill hierarchy. Let me use as an example a skill that you've seen or a task that you've seen, and that is the task of starting an intravenous injection. Now, you've seen this on television many times, even if you may not have seen it in the real world. Now, assume that the analysis has been done and a series of skills have been derived that need to be taught, and now we're going to put those skills into a hierarchy. Always begin your hierarchy drafting with a well-stated objective, because with a well-stated objective, you will be able to determine whether the subordinate skills, those shown beneath the terminal skill, are in the proper place. And by the way, I may refer to these as subordinate skills or sub-skills or prerequisite skills or enabling skills. They all mean the same thing. They all mean those things that need to be in place before a higher level skill can be practiced. So let's begin with a terminal objective. I've already written it out. I've left the criterion off to keep the reading load down. Now let's take any 2 skills and begin with them. And here's how you build your hierarchy, 2 skills at a time. Ask yourself, is it possible to learn this skill without knowing how to do that? Could we practice reading a chart without knowing how to collect equipment? Well, we could, couldn't we? Therefore, these items will appear on the hierarchy side by side. Let's take another one. Could you practice decoding medical terminology without knowing how to collect equipment? Sure you could. Could you practice decoding medical terminology without knowing how to read a chart? Yes. But can you practice reading a chart without knowing how to decode medical terminology? Oops, no, you can't do that. Therefore, this becomes a skill that is subordinate to this one. So before you can practice reading a chart, you need to know how to decode medical terms. Let's take the next one. Prepare a patient. We can practice, this means, by the way, psychologically preparing the patient, speaking to them, talking to them, smiling at them as you explain what it is you're about to do to them. So you can practice doing that without knowing how to collect equipment or without knowing how to read a chart, and so we put it in parallel with these other items. Let's take another one. Locate vein. Can we practice locating a vein without knowing how to collect equipment? Sure we can. Without knowing how to prepare a patient? Yes. And without knowing how to read a chart? Again, yes. Therefore, we have another parallel skill, and locate vein, if I can get it, will go there. Now, once you have all the items, all of the skills in your collection placed somewhere on your hierarchy, then you want to check it for completeness. And you do that one pair at a time, the three-step procedure more or less. The first step is to first make sure that everything on your hierarchy is a skill rather than subject matter. Do that by checking to see whether you can put can in front of each item. For example, can read a chart makes sense, can prepare a patient makes sense, and so on. Had we written things like physiology or anatomy, it wouldn't make any sense to say can physiology or can anatomy. So that's the clue that you're not dealing with a skill, you're dealing with subject matter. Second step is to check them a pair at a time to see whether they're in the right place. So we say, is it true that people could learn to collect equipment without knowing how to prepare a patient? And if it is true, then you leave it where it is. But if it's not true, then you make some adjustments. Finally, check to see whether there are some missing sub-skills. Sometimes you have to take your hierarchy down a level or two before it gets to where your target population is. Watch. Before they could practice decoding terminology, there's something else they have to be able to do, isn't there? They would have to be able to read the language. If you can't read the language, you can't practice decoding the words that are written on the chart. What about prepare a patient? Before you can practice preparing a patient, you need to be able to speak the language. And it doesn't make any difference who you are or who they are. If you can't speak their language, it's difficult to talk with them and explain to them what you're about to do to them. So once you've got all of the sub-skills added, then you can draw your lines and finish this off. Notice that I use these yellow stickies. It's much faster that way. You don't have to do a lot of erasing. Wait a minute. Looks like we have to be able to read the language not only to decode medical terminology, but in order to identify the proper equipment. So let's draw it this way. Notice how this hierarchy is wider than it is long. Literally, you can look across a room and tell whether a hierarchy is likely to be okay. If it goes this way, side to side, it's much more likely to be in good shape than if it goes this way. If you see a long one, it means that somebody has got the task analysis confused with a hierarchy, and they've got steps there, steps of a task, rather than skills, and rather than having a hierarchy showing the relationship between those skills. So that's an easy way to check. And the reason it goes sideways is because most of what we teach is independent from one another. That is, most of the skills we teach are independent of most of the other skills that we teach. Well, that's how it's done. But you need to have a way to check whether a course is teaching what it should be teaching and whether it's teaching it in relatively the correct sequence, and whether you're making best use of your resources. And if you've got a hierarchy, that tool will help you with those important issues.